like this one was a little bit hard because I felt like a lot of the answers could have been appropriate, and like the answers were a little bit similar. So I ended up ranking first, like acknowledging that those are difficult questions and may not be the best time, because I think in this situation I decided it was the most important to act as a peacekeeper between the family and your sibling. I mean, the least appropriate response by far was joining in on the questioning to make your sibling respond, because that's just, like I said, it's important to be the peacekeeper, get them to stop questioning, get your sibling to stop being uncomfortable. And then, so yeah, like with the other ones, it was easy to pick number 1. It's definitely easy to pick number 5, but then the ones in the middle were kind of more challenging.
What experiences, if any, did this make you think of?
Like I said, I've never been in this exact situation, but I think I've definitely been in groups of people where there's probably a topic that people know is a little bit taboo, and they go and ask questions about it anyways, and it kind of just makes things awkward for everybody. And I think in this situation, there's always people who, they're not directly involved, but they end up just sitting there and just witnessing it and not doing anything. And I think it's more helpful to be the person that diverts the conversation, maybe says that's not appropriate, let's talk about something else, to try to help the person that's uncomfortable.
What if this was in a healthcare setting, you witnessed a patient who was being questioned by their family? How does that impact your response?
I think that's definitely a lot trickier than this specific problem, because this one is within your family, and personally, I feel like within my family, I think I feel at ease, saying things like, hey guys, let's stop doing this, or I feel like it's easy to kind of speak my mind and maybe confront people in a loving way. But then when you're witnessing it happening with another family, that's a little bit trickier to interact with that dynamic. I think probably in that situation, I probably wouldn't step in and say something, but I would probably talk to the patient afterwards and ask if they have any concerns with how they were treated by their family, and ask if there was any way I could help.
So you mentioned earlier that you function kind of like or you feel like you would function as like a peacemaker. Mm-hmm. Do you feel like that's not always a pharmacist role per se?
That it's not a pharmacist role? I feel like, that's obviously not the most important role of a pharmacist, but I do think that is something that pharmacists have to deal with a lot in any setting, especially because pharmacists are, they always say that pharmacists are the most easily accessible of the healthcare providers for patients, so I feel like pharmacists are always kind of between the doctors and patients, and kind of acting as middlemen sometimes. So I feel like there is a kind of peacekeeper role in the pharmacy profession, even though, it's definitely like a lower priority role, but it's definitely there, and it happens.
Okay. What knowledge or ability do you think this question is testing?
I think it's testing about if you're witnessing something happening to someone, and if you're picking up that they're uncomfortable, if you're going to act on that, or if you're just gonna kind of let it happen.
Okay. Last one. So how did you decide how to rank these options?
Okay, so this is about speaking with a patient's family about chemotherapy for their young son, and then the parent becoming upset. So this was a little bit challenging because it was kind of a pretty sad situation, that you can kind of imagine people going through, and I think you can definitely I think there's two ways to approach this. You can either just, you could think that the parents are being, stupid, for lack of a better word. You could think, oh, well, they need to hear about these side effects, but I think that would be the least appropriate response. I think the other way to look at it is to sympathize with them and say, I understand that they might not want to hear these side effects. I understand that this is probably really hard for them. So the most appropriate, I think a lot of these options were actually challenging to rank because I don't actually really know what the best thing to do in this situation is, but I ended up ranking first, scheduling a different time to talk with them, because as a healthcare provider, I do think it's important for them to be aware of negative side effects. I think they can make easier decisions knowing all the information. I don't agree that they should just be ignorant to it. I do think they should be educated about it, but at the same time, you need to be sympathetic that they don't want to hear it. So I think least appropriate responses would be, just saying, okay, well, we're not going to talk about it, and just documenting that the education was complete. That's not appropriate. But also, it's not appropriate to just, continue barreling through and say, well, it's hospital policy, let me just continue and not care about them at all. So you need this middle ground where you're sympathizing with them, but you're also communicating the information to them.
What experiences, if any, did this question make you think of when you answered
it? It kind of made me think of books that I've read about, or the book that we read that we had to read coming into pharmacy school.
What book was that?
I forget what it was called. Something about breath, and it was about a physician that had cancer, and he was a surgeon, and then and then he passed away. Oh, I forget what it was called, but we had to read it coming into pharmacy school. Mm-hmm. And because that book talked about, how much information you should communicate to the patient, and kind of when to stop if it's making them too upset, when to keep going because they need to know the information. Yeah.
What if the setting was different and that this was outside of a healthcare context? And it was just somebody wanting to stop talking about something?
I think I would be more inclined to go along with their wishes. Okay. And stop talking about it. It depends on what it is, because in this situation, talking about negative side effects, I think those are important to know. I think that's important information, so that would make me still want to convey the information. But if it was something that was less important, I would be more inclined to go with the person's wishes and just kind of drop the subject and stop talking about it.
And then what knowledge or ability do you think this question is testing?
So kind of the two responses that I talked about at the beginning of this question is whether you have the response that knowing side effects is important, science is important, you still need to communicate that information, you need to communicate it to them no matter what. If you're that kind of person, or if you're the kind of person that is going to be more sympathetic to their wishes and do what they wish, or if you're the kind of person that tries to balance the two.
Okay, so I'll take that. Okay, so the last questions I have are just related to the test in general. So were there types of questions that you felt like were easier to answer compared to others?
Yes, I felt like the easier questions to answer were the things that were kind of lower stakes, and they didn't have as many components to them. So seeing your sibling upset about questions with your family, I feel like it's a little bit more straightforward. You either are sympathetic toward your sibling or you're not. And I felt like those questions were a lot easier to rank, and they were also kind of more relatable situations, and so I kind of already knew like what my response would be to those situations. But the more challenging ones were definitely the ones where